Dr. Joanna Schultz from Health Quarters in Burlington, Ontario. And today, Kristen and I are going to help demonstrate how to use the foam roller. We often give this exercise to patients for multiple reasons. One is to help to reduce the muscle tightness that they're feeling in different parts of their body. It also helps to break up any scar tissue or adhesions. In turn, it helps with muscle recovery from an activity or a sport and increases overall flexibility. So today we're going to have Kristen her glutes along the back side of her sacrum. So she'll just sit on the ball and then roll forward, on the foam roller. And she just bends her knees a little bit and comes a little more forward. Bend your knees there and just come up and down those glutes in that sacrum. And from that position, Kristen's just going to move down towards her hamstrings and she's going to roll both of them out at the same time, just forward and back. With foam rolling, it's about doing small, short rolls over one area. If you find an area that's very tight or you maybe have adhesions in it, you can go a little harder over that area in smaller sections. And then once those muscles are nice and warm, I'm just going to have Kristen crisscross one of her legs over the other, and she'll put a little pressure through that one hamstring. And then she's going to switch to the other side. If you need a break, Kristen could drop her glutes back onto the ground and just to give her wrists and hands a little bit of a break. And then she's gonna roll through the back of her knees. And then she's gonna work her way all the way down to her calves. She can move the foam roller or she can move her body up and down that foam roller. After those calves are nice and warm, maybe 5 or 6 times up and down that foam roller. If she needs to take a break, she can take a break, or she'll just crisscross her legs one over top of the other. This will put more pressure through the calf on the bottom. It'll get deeper into that tissue. It may be a little tender or a little painful on you. And then switch into the other side. So once she's finished through the whole back side of her lower extremities, we're going to have Kristen flip to do the front side. So she'll just flip and put her quadricep muscles, so the front of her thighs on top of that foam roller. Again, small rolls, just up and down in short sections. She doesn't have to try to roll the whole quadricep muscle at one time. And once she's gone in an area that feels nice and warm, she might move now a little more forward on the foam roller, walk her hands forward, and just get right above the knee and the quad. As she's warmed up that muscle, what Kristen's going to do is just plant one of her legs on the ground, whichever one she chooses, and roll towards the other direction, to just put more pressure through the front of that quad. So she's using the opposite leg that she's rolling. She's using that foot on the ground to move her body forward and back. And now switch to the other side for me. So she'll plant her right leg here, just on the ground, and then she's going to use it to roll the front of the left quad. And now finally, while she's already in that position, what we'll have Kristen do is roll out her glute medius and her iliotibial band. If you notice, she just rotated her body slightly to the side a little bit more. She still has the leg on the ground as her push leg. And she's using small sections and rolling up and down. If she finds a really good spot with a great trigger point or a lot of myofascial adhesion, she's going to spend a little more time over that area on the foam roller. And she's going to work her way from the top of her hip all the way down towards her knee, again in small stages, maybe depending on your height, or she might do it 3 different sections. And then let's switch to the other side. Again, she's starting in one area and working her way down. And that concludes foam rolling of the lower extremities. So just keep in mind that you don't need to use the foam roller every day, maybe 3 or 4 days a week, and you might find out whether it's better for you to do it right after your sport or taking a rest and doing the foam rolling on the days off.